قال الله تعالى عز وجل والقرآن المجيد والفرقان الحميد بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين. Allah subhanahu wa ta'ala mentions in Surah Baqarah ayat 155, and certainly we shall test you with something of fear, hunger, loss of wealth, lives and fruits, but give glad tidings to as-sabirin. Next ayah Allah subhanahu wa ta'ala mentions allazina iza asabatum musibatun qalu inna lillahi wa inna ilayhi raji'un, who when afflicted with calamity say, truly to Allah we belong and truly to Him we shall return. So inshallah, so this will be more of a information session followed by question answer on the fear that we all have about the ongoing coronavirus. So there is clear-cut guidance in our deen, in our sharia, how to deal with these calamities. There are several ayahs about that. There are several ahadith about that. Without going into the hadith part of it, I will probably end up with one hadith which is applicable here. In one hadith, Aisha radiallahu anha mentioned, quoting Rasulullah sallallahu alaihi wasallam, when such a calamity emerges, because at that time there was a lot of ta'un, which was plague that was playing a role at that time. When such calamities occurred at that time, Rasulullah sallallahu alaihi wasallam advised us that this is an azmaish and an azab. And but for the mu'minun, those who believe, it is actually, once they experience the right sabr for it, it comes as a rahmah, as a maghfirah. And during that calamity, and if a mu'min Muslim dies, his status is that of a shaheed. So there is clear-cut guidance. So now we all are worried about it. We all have concerns. Some of people are panicking. There is a lot of misinformation also about it. There is some true information about it. So I thought we would talk about it and see if brothers have any questions. So the virus that is being talked about and raising fears, concerns is this coronavirus. And you may have heard other terms like COVID-19. COVID-19 is not a virus, but it is the illness that occurs with this coronavirus. It is a coronavirus disease. That's what is called COVID-19. The virus itself has been named as a SARS-CoV-2. But for us, knowing it as a coronavirus is enough, because coronavirus is a big family of viruses. It is one of the type of viruses known as beta coronavirus. Some of us in the recent past heard about other types of coronaviruses. One is the SARS virus, one is the MERS virus. So those viruses also raised a lot of scare and alarm around the world, especially during the time of Hajj and Umrah, and it was a big concern at that time. So the common thing with these three types of coronaviruses, the MERS coronavirus, the SARS coronavirus, and this the SARS-CoV virus, which is the current one, is that they all have the common origin in bats. So we all have heard about this outbreak in part of China, which is the Wuhan province in China, and they have a habit of, or they have a culture of close contact with seafood and a lot of zoonotic animals. And so the initial investigators and scientists found that the initial spread has been from animals to humans. But then we have seen people in different communities getting it without having been in that part of the world. So now the transmission is not, initial one happened from these animals to humans, now it's human to human. So that is the concerning part. Otherwise we could simply avoid that area, Wuhan area, and we should be fine. Now it's a community spread. That's what is of concern. So what is the situation around us in the United States? We have agencies, the CDC, local Department of Health and other agencies monitoring it closely. There have been some pockets in the country. As we all know, it started off in the West Coast from Washington State, Seattle, California got involved. Now it has moved to East as well. Yesterday, state of New York declared a emergency actually because they found about 50 cases of this virus in Westchester County, which is close to Manhattan, or a couple hours from Manhattan. So that's raising concern in the Northeast as well. So right now the cases that we are experiencing, in the beginning one from Wuhan, are people when it has been imported to other areas because of travel. And also someone who is in contact with a sick person, they can get sick. Now the biggest concern is spreading it within the community. How severe can the illness be? Alhamdulillah, the good thing is that in most cases, the illness is of a very mild intensity. And some of people may even be asymptomatic, so that we don't even know they have the virus. So, but those people who really get symptoms and manifest this illness are the ones who are either elderly, have a lot of medical problems, which could be, their immune system is low, they have diabetes, they have cardiac problems, or some infections to begin with, and they are the ones who can get this symptomatic illness. And those are the people who can transmit. Usually if someone has the virus and is not symptomatic, they may not transmit the disease. But people who are symptomatic, they are at the highest risk of transmitting it to other people. So in the US, as of today, there are about 500 cases that we know of. And there have been several deaths that have been reported also. But if you look at globally, worldwide, as far as we know, more than 100,000 people have been affected with this virus. And unfortunately, the deaths have been about 3,500. So if you do the math, 100,000 or more and 3,500 deaths, so it makes about 3.5% mortality rate. Way higher. It may actually not be that higher because there may be people who have the illness and we don't know about them. So that 100,000 could be 200,000, 300,000, and the deaths are the same. So the mortality may be actually less than what is being reported. But certainly the mortality, as far as we know from what is reported, is way higher than death from a influenza or flu. Influenza mortality rate by many accounts is about 0.1%. So this is about 2 at least, or 3.5%. So the chances of somebody with this illness dying is about 20 to 30 times higher than the flu virus. So that is the concern. But the good thing is, it is still not very widespread. It is still what is known as endemic, which is isolated. It may reach to a point of being an epidemic, but the biggest concern is that it may become what is known as a pandemic, which spreads, to majority of people all across the globe, all across the world. So hopefully that won't happen, because as the temperatures go up during March and April, it is felt that this virus actually may die down. So, for the risk assessment, I think this is important to know which people are at immediate risk of getting the virus. The overall risk is low. People who are at a high risk of getting the virus are the elderly and the sick ones, and people who are in the healthcare profession, because healthcare profession, obviously, they will be taking care of people who are sick from different kind of illnesses. They are at high risk. People who are sick and their caregivers or family contacts, they are at high risk of getting the illness.
What about kids?
Kids, fortunately, the newborns especially, haven't been known to acquire this infection. That is a good thing, alhamdulillah, because kids usually get a lot of these rhinoviruses and other types of viruses. But corona, alhamdulillah, so far as we know, kids are being spared, which is from Allah subhanahu wa ta'ala. Then people who are traveling across, from areas endemic or highly prevalent with these illnesses, they are at high risk. How does it spread? So like any illness is like any flu symptoms. It can cause rhinorrhea, it can cause runny nose, sneezing, coughing, flu-like symptoms, fever. And so anyone who has that could be suffering from a common cold. could have allergies, could also have flu, could have coronavirus. Unless it's tested, there's not a way to know that.
Breathing issue.
Breathing issue as it progresses, that can happen. So the spread is, I want to differentiate, and I bought these two masks for that reason. Spread is what is known as droplet infection. So what are droplets? Droplets are these mucus drops that if somebody has the virus, the coronavirus, and they sneeze, they cough. So you will see those droplets coming out, and it can spread within 6 feet of that person when he sneezes or cough. So droplet, compare that with what is known as an airborne illness. Airborne illness is something that one can get from diseases like TB, tuberculosis, because tuberculosis bacteria can be in the air. So for that, this kind of mask is needed. This is a N95 mask. So, but for this infection, it's a droplet. This kind of a regular or a surgical mask is enough. People are panicking and they're buying these masks. They are not needed really. But if someone is taking care of a person with TB, because it's an airborne, it's in the air, so you need this airtight mask. For that droplets, this is enough. So I will come back to these masks and whether we should be wearing it in the general community or not. So one is that droplet infection. Somebody who's sick, cough, sneezes, it can transmit, and it can transmit to the eyes, nose, mouth, those three areas. Or it can transmit from surfaces or objects. So if the virus has landed on the surface, for example, the question is, how long would that virus last on this surface or this surface? So we don't know, but estimates are that, I was just at a meeting in Washington, D.C. over the weekend. Over there, they were talking mostly about dialysis patients. So it is said that this virus can last on a substrate from as little as less than 3 hours to up to 10 hours. So it can be quite variable, from less than 3 hours to up to 10 hours. So that's why it's important to not to touch these objects, not to touch the surfaces, and if you have touched it, as soon as you go home, wash your hands. So that will take care of it. So again, people who are sick, you can contact it by droplet infection, droplet spread, or by touching the surface. Avoid touching the eyes, avoid touching your nose, avoid touching your mouth, especially when you're leaving from public places or office. If somebody is sick with flu illnesses, better is to stay at home. Everybody understands these days you can get an excuse, you can maybe work from home. So if somebody is sick, also try not to come to public places. Don't come to a place of work, place of worship especially. I think there's a fatwa that is from scholars that somebody is sick, even the masjid can ask or stop those people from coming to the masjid because of the wider risk and better safety for the general Muslim. Somebody is coughing or sneezing, cover it with either your elbow or your tissues. But don't store that tissue. As soon as you use it, throw it away. So that's important. Back to this question about mask. CDC recommendation for using a mask. At this time, CDC does not recommend wearing a mask, the general, not the N95, but the general mask for the general population, for the general public. It is not recommended. It will not help prevent the spread of disease that way. What is recommended is washing hands, using hand sanitizers. There is a acute shortage of hand sanitizer. I was trying for 2 days. I could not find it anywhere. But hand sanitizer, the important thing is you have to be careful that it should have at least 60% alcohol in it. So that becomes more of a sherry. So we may have to ask our scholars and our ulama about what is the ruling of you used it and you're coming for salat. Should we be washing hands before we pray? So that's a separate topic we can ask our scholars. So hand washing is recommended for 20 seconds. Soap, thoroughly wash it for 20 seconds. That should take care of it. But if you are traveling or you are in your car at other places, use the hand sanitizer because that's an easy way of keeping it away. So we talked about the symptoms and the spread. Treatment. Unfortunately, we don't have a treatment available for this coronavirus. At this time, treatment is mostly supportive treatment, symptomatic treatment. People who feel that they have the illness, need to go to their doctor, go to urgent care, emergency room. But that also is not a guarantee that you will be tested for this virus. Because at our hospital, at Grady right now, if we're suspecting someone to have this illness, it's not just we order the test, we have to go to speak with the epidemiologist. Hospital has designated one infectious disease person. She's the epidemiologist of our hospital. You have to discuss it with them and they will kind of triage it. And when they approve it, then only will the test be done. But other places are different, so it may be changing on a day-to-day basis as we have more testing available, so we don't have to be that selective in that. We don't, like flu, we don't have a vaccine for the coronavirus, and flu also can be treated with some antiviral medications like Tamiflu. We do not have that available for coronavirus at this time. Talked about this Wuhan province in China. Alhamdulillah, what they have done is people, even Americans or US citizens who are there working in that province, they haven't been allowed to come back, or nobody's allowed to travel to this Wuhan. And the beauty of our deen, our religion, which is a complete deen, is that Rasulullah Sallallahu Alaihi Wasallam gave us this guidance, these recommendations 1400 years ago. And in a hadith, Prophet Sallallahu Alaihi Wasallam said, if you hear of an outbreak, which was this ta'ud at that time, plague, which was very prevalent, if you hear of an outbreak of plague in a land, do not enter it. But if a plague breaks out in a place, while you are in it, do not leave the place. That's exactly what is the recommendation from the agencies, from the experts on this opinion. If there is a place that has that, do not leave that place, and also do not go to that place. On that related hadith, which is a long hadith, I'm going to summarize it. Umar bin al-Khattab, he departed to Sham once with a group of his Sahabi. There were many famous Sahabi with him. So they heard about a place, Sarg, which had a calamity of plague at that time. So they were debating whether they should go or not. So he made mashwara. First of all, he called all the elders from Mahajirin. And he got, some gave we should go, some said we should not go. Then he called the Ansar. They gave him the same, difference of opinion. So then he said, okay, let me wait. And then, alhamdulillah, one of the famous Sahabi, Abdul Rahman bin Auf, came and he said, I have the knowledge about this affair. Rasulullah Sallallahu Alaihi Wasallam told us the same hadith, that if you hear about an outbreak of plague, it doesn't necessarily mean only for plague, it applies to other calamities in our time. If you hear about it in a land, do not go to it. But if the plague breaks out in a country where you are staying, do not run away from it. So this is the beauty of our deen, inshallah. So I'm going to stop here, see if you have any questions. I can try to answer. Or if you have any additional comments you would like to add, inshallah, we can do that.
So what about source? Source you are saying bad is...
So source of, so these three types of coronaviruses, or the coronavirus in general, come from animal source. So the animal source could be cattle, could be cat, could be camels, as well as bats. So 3 C's and bat. But the one that is common to these three types of viruses, the MERS, SARS, and the corona that we are facing, is from bats. So the initial transmission that happened because of whatever their practices are with seafood and zoonotic animals was from animals to humans. So that happened. Now the other piece is transmission from humans to humans. So that's what we're seeing, because people are not going to these markets anymore. So now it is spreading from one person to another person. So that is the source right now. That's why we're seeing it within communities now.
What is the survival rate of this virus in a human body?
Well, that's also not known, because the new illness, we do not know much about it. But the good thing is the severity of illness is very mild in most cases, as long as the person is healthy. But if someone who is sick is elderly, has a lot of medical problems, his immunity and his overall
immune is very weak.
Immune system is weak, they cannot fight infection, then these are the people who will have symptomatic disease, and it can progress to pneumonias, bilateral pneumonias, and then multiple organ involvement. That's when death.
Normally the other virus, how many days it survives?
Well, the illness usually is for a flu is, weeks, few weeks, less than few weeks, and it goes away. It can be less when you treat them with medications like Tamiflu, so the duration of illness goes down. So it is week to 2 weeks, but for corona, it depends on how it progresses. Because if it involves more than one organ, then obviously it will be a prolonged illness in that person.
What test will be conducted on the affected person? Is there a kind of blood test or?
So there are, CDC has the recommendation for that. So it is a swab test as well as a blood test. So, but again, as I said, testing, we don't have the capability to test a whole large number of people who ever come with the symptoms, unless you're pretty sure, or the where you're going, or they are pretty sure and convinced that this person needs to be tested, then it will be tested. The samples do get sent out to CDC. Now in this country, more and more private companies are being used to develop the test, and so we can expand that testing to a general population. So at this time, we have limited capability to test everybody.
I heard they are making millions of kits for it.
Should we, is there, if we get a sore throat or mild fever or something, is there anything that we can do something to find out whether we need to take it seriously and go to the doctor or just take some
But
medicine?
if you have allergies, most likely then what you're having, if you usually have allergies, because I have allergies year around and my symptoms, I know how they are. But when it's more than that, when you're not feeling it's your usual symptoms, fever, usually with allergies you do not get fever, right? Sore throat, coughing, sneezing, malaise, feeling weak, body aches, flu-like symptoms, then that's a concern. So at that time you should go to your doctor.
Should go to doctor.
Yes,
That's the
you
thing.
should go to your
Don't let
doctor.
yourself treat and try to
Right,
be a-
because the chances are that in that case you probably will be tested.
So
But if
better
it is,
to go to-
but if it is a common cold, if it is, not these symptoms that I've described, then the chances are that you will not be tested. In that case, if you feel like you can go to work or participate in activities, do that. Otherwise, you could stay at home also. That's a safe advice.
The
Is there any,
symptoms, what you mentioned is all symptoms would be there, or is any of the symptoms, either of the symptom can be?
Well,
there?
symptoms, as I said, most people may have mild disease, but when people do have symptoms, that means they will have these flu-like symptoms.
So
Fever
generally,
is an
if anyone
important.
is having fever for say
Yeah.
3 days, or
Right.
only fever, not other sneezing
Well,
or coughing.
it won't be any isolated fever only. It has to be some other symptom with that, respiratory symptoms, coughing, sneezing, sore throat, trouble breathing. So those kind of symptoms are usually associated.
why there is so much panic about this virus?
So panic is, I think, that's human nature. But then, there are also some myths and wrong information being spread out that this illness is going to affect 70% of the world population, and people are panicking. People, as I initially recited that ayah, we need to be patient in this. We also need to be informed in it. We also need to, have tawakkul on Allah subhanahu wa ta'ala and use our precautions. I'm going to summarize, some of these things that I think we should do. I was at, yes, question.
Do you know the temperature, why it can't be survived? Temperature level?
Temperature, colder temperature, it survives better. As it warms up, that's the hope that as the temperature warms up, as we approach spring and summer, it doesn't survive in warmer temperature. So a lot of things are not known about it, these specific things.
It is also said that until 14 days will not be known about this virus. It is there.
So there is something what is known as a asymptomatic carrier. So some people who are healthy may not even develop that symptom. So as I said, but that's okay, because even if somebody healthy like person A has this and he's not symptomatic, the chances that he will spread it out to others is less. So that's an okay thing, even though we don't know that he had it. So it usually spreads from a person to another when that person is symptomatic, and that he produces those droplets where he can be a source of infection.
Should we avoid seafood because of this issue, or is it in US you don't have any worry about any food?
So more so, zoonotic animals, these strange kind of animals that they eat, bats, and bats are eaten by snakes, I guess. And and wolves also, they had this market where there were wolves, bats, some zoonotic animals. So, alhamdulillah, we're not in any way, shape or form near those animals.
No, but
Seafood is
meaning that eating fish or
fish,
something here should be
yeah,
okay.
it should be okay. As
That's
far as
what
I
is
know,
said.
there is no restriction on that at this time. So, I was at Masjid Taqwa, and so there, so few, these are not, any hard and fast rule, but alhamdulillah, we greet each other, we should spread salam. We don't need to spread germs. So if anybody offers you their hand and they don't shake your hand, do not get offended. So it's okay. CDC recommends doing an elbow thumb.
Because
So
that's what I wanted
Yeah.
to say, that in masjid, how do we implement? Because
Yeah,
we
yeah.
have not a bad habit, a good habit.
It's a
of
good
shaking
habit.
hand,
Alhamdulillah, it's a good
period.
habit. Let's hold off on that habit for
Yeah,
now. So
for
please
the
don't
time
feel
being, let's not
offended.
shake hand.
When I came, Ramzan was there, so I gave him an elbow bump, but I did also.
But I did Muzaffar.
Another
That's okay.
recommendation
So-
is to clean nose through left hand, not right hand.
So
Alhamdulillah, with our, as Muslims, five times salat, 5 times wudu.
That helps.
Renew your wudu as much as you can. As you go home, wash your hands when you go home, because that was one of the sunnah of our beloved Prophet Sallallahu Alaihi Wasallam.
I carry the spray in my car, that whenever I leave,
Yeah,
I just
do that, and when you go home, do it and wash
the
for
hand
20
thoroughly,
seconds.
wash the hand
So
thoroughly.
what is the
if-
food to like to increase the immunity?
immunity.
Vitamin C.
Usually, it's vitamin C. Vitamin C.
What are the
Lemon.
Source for
Lemon, orange.
Lemon is good, because even for flu, vitamin C is also helpful in that. But we don't know what the specific treatment is. But general eating healthy, exercise, keeping yourself free of illnesses, vitamin C, multivitamin, those all things help.
One of the doctor was saying, use the lukewarm water, not very heavy warm water, and squeeze the lemon in it and drink it. That will help.
But I hear like the ginger and the garlic.
Yeah.
Those are all good for any
Immune
kind of
system, improving the immune.
upper respiratory illnesses, so that helps. So any
Okay.
other question?
I
Comments?
have one more question
Yes, yes.
regarding transportation.
Yes.
Suppose going to office, use some public transport. What kinds of precautions is required?
So at this time, there is no restriction for that. So that if that restriction comes, it will come from the Public Health Department of DOH or CDC. At this time, there is no restriction on you participating in any public transportation or flying around the country, or having gatherings like this that we have in Masajid or other places. So it's okay. But if somebody is sick, try to avoid, try to stay home, try not to go to these places. And if you're sick, stay at home, put a mask, so the people around you will stay healthy, inshallah, and free of illness. So,
I think that's quite good session.
alhamdulillah, jazakallah khair for your time. Assalamu alaikum.
Islam.
Jazakallah.
Jazakallah.